Do you feel like deep squats are off limits after 50? Maybe you're worried that they're bad for your knees, or maybe you're worried that you won't be able to stand back up. But when done correctly, deep squats can have great benefits in terms of muscle strength and flexibility, joint mobility, spinal health and posture, core control, and balance. In this video, I'll show you a step-by-step process to deep squat safely. So let's get started. Now, first of all, are deep squats safe for people over 50? The main concern of people over 50 is knee problems. And it is true that the deeper down into a squat you go, the more compression it creates behind your patellofemoral joint. But that's largely true with active squats, for example, when you're bearing weight through your quadriceps. Once you get down into a resting squat, sometimes known as an Asian squat position, it's actually a pretty passive, comfortable position. And it's called that because people in Asian countries, or sometimes in more primitive societies, use this as a common resting position. And once you're here, it really doesn't take a lot of force or effort to maintain it once you get used to the position. Now, it can feel a little bit uncomfortable at first when you're first learning the position, but largely that's in your muscles, in your thigh muscles or in your groin muscles or in the back of the hip as you're learning to access new positions and ranges of mobility that you haven't had before. What you shouldn't experience with this is deep joint pain, deep inside your joints. So if you do experience that, just back off. But again, we're going to go through a step-by-step process, and you just do the level of squatting that you feel comfortable with. Additionally, people with really severe knee arthritis or people who have had joint replacements should check with their doctor before doing this, and I will show some modifications that are a little bit easier at the end of the video. Additionally, people who have had a complete ACL tear at some point in their life and just never had it surgically repaired, you do need an intact ACL to be stable in a very deep squat position, so use precautions as well if that applies to you. So now let's get started with the steps. Step one will be to do a supported squat or a counter squat. This is great to do when you're in the kitchen cooking and you have a few spare minutes. Slowly sink down as far as you feel comfortable going. And then once you get to the bottom position where you start to feel just a very slight bit of discomfort, hold that position for a few seconds and then slowly come back up. Slink down slowly. And each time, see if you can get just a little bit farther than you were able to the previous time. Again, a little bit of slight discomfort while doing this is okay, but you shouldn't experience any extreme or sharp pain. If you do, just come back up to a slightly higher level and hold there. But go down to the level that you can comfortably. Try and hold it 5 to 10 seconds and then sink down again. See if you can get a little bit farther. And once you find the deepest level that you can comfortably go, then try to hold that position for 30 seconds to a minute. This helps build up the endurance in your thigh muscles and get you a little more used to being down in this deep squat position. Over time, you want to progress down deeper and deeper until you're able to get into more of a full resting squat position. And again, once you're at this point, it's a pretty passive position. This feels good on your knees because you're really not bearing a whole lot of weight on them. At this point, your center of gravity is actually down a little bit lower than your knees. It also rounds out L5-S1 a little bit. So this is a very comfortable position for people with spinal stenosis or degenerative disc disease in their lower back. So I think you'll be surprised at how good this position actually feels once you're able to get there. Then when you're ready to stand back up, push your feet down into the ground while pulling up with your arms to come back up to a standing position. Additionally, you can take a step back like this and work on your thoracic flexibility, improving thoracic extension in your upper back and your lat flexibility. This helps with spinal posture when you are ready to go to a full unsupported deep squat. It helps you to stay a little bit more upright like this versus rounding out your lower back like that. So that's step one, the counter squat. For step two, we're going to move a little closer to an unsupported squat. We're still going to use support from the hands on the floor like this. So reach down as if you're touching your toes and place your hands down on the floor. It's okay if you allow your knees to bend because ultimately we are going to be bending the knees anyway. And then work through coming up and down through that deep squat position. A lot of the load is actually taken through the arms here, so this is relatively easy to do, just dropping the hips up and down like this. It does require a little bit of leg force, but you are taking a significant amount of that through your arms. This also helps with the fear that you might get down into this deep squat position and not be able to stand back up, because if you do, you can just put your hands on the ground like that, stick your butt up, and stand back up that way. This does help a little bit with that fear component, as well as just getting you used to moving through that range of motion. Once you get down into this full deep squat position, you'll notice if you keep your hands on the ground here, you're really rounded out through your back, which is an okay position to be in, but sometimes you might want to be a little bit more upright or work on your spinal posture. So you come up like this and start to lift your chest up. Now you'll note as you lift your chest up, your knees come forwards a little bit, and you might find that your heels come up off the floor. I have a little bit of stiff ankles and calves, so my heels do come up a little bit when I do that. When you have your heels more down on the floor like this, or when you have your hands on the floor like this, your heels go down a little bit easier. If you do find that problematic to come upright, this does put a little more stress on your knees and uses your quadriceps a little bit more. It makes it hard, not impossible, to activate your glutes like this, but it does make it a little bit harder than if you're able to drive your heels down through the floor. So if that applies to you, just get a set of yoga blocks, one underneath each heel. Make sure they're really wedged in there well. And this helps you to sit upright in a deep squat a little bit easier, allowing you to put a little more pressure through your heels. Next, you can work on spinal posture by bringing your arms upright, moving overhead, much like we did with that counter stretch before. We're stretching the lats to move the arms up that way and then back down. So those were the steps to get into the deep squat position. Now, what about getting back up? This is sometimes a challenge for people, especially if you've stayed down here for 30 seconds, a minute, 5 minutes. Your legs can start to get used to being in this position and then feel a little bit stiff when you start to come back up. In that case, there is always the option to just push your hands down into the floor like this, lift your bottom, and come back up like that. But if you're working on the leg strength component of being able to stand up from that deep squat position, a few things that can help out with that are pushing your knees out. This helps stretch your groin. It helps you to keep things in a little bit better alignment. It also helps you to activate your hip external rotators if you're able to turn out a little bit better. And that allows you to activate your glutes a little bit better when you're going to stand up. That's also a very nice stretch through your groin there. Just going down, putting your hands on the floor, pushing the knees out to the side. This helps with hip mobility, flexibility in the adductors or inner thigh muscles there. So that's another option. Then again, when you are ready to stand up, drive the knees out to the side as best as possible. That'll help you to activate your glutes and then push back up to a standing position. Now, if you do have knee arthritis or you've had a joint replacement, chances are you may not be able to access that really, really deep resting squat position, but there are still benefits to going as deep as you can with the squat. Just going down into a partial squat like that, doing the counter squat that we did earlier, or doing a chair squat or sit to stand. Those are all great options for people who do have knee arthritis. If you'd like more strengthening tips, check out this playlist over here, or for more knee pain tips, check out this one down here. But before you go, if you found this video helpful, make sure to give it a like, and if you haven't already, subscribe to the channel so you get notified of my future tips. Thanks for watching, and I'll see you in the next one.